My name is Sharon Inouye, and we'll be getting started around 8:30. And I just want to welcome you all to this special breakout session. I'd love to just hear where each of you is from and your interest in this area. I know Rita very well. Hello, Rita. Thank you for joining. Delighted to have you here. Xuan?
Yeah.
Could I find out where you're from and your interest in aging? Hi.
Hello. Hi, everyone. My name is Sharon, and I'm from Taiwan. I'm especially from the park recreation and tourism background, so I would like to know more about how does that affect the quality of life of aging. So, yeah.
Thank you. Could you repeat what background you said?
Leisure studies, like park, recreation, service.
Oh, recreation and park. Oh, wonderful. Very good. Oh, and Dr. Nakatani, hello. So good to see you. Thank you for signing on.
Hi, Sharon. How are you?
Hello, Yoki. Wonderful to see you.
Yes, I come to this meeting to spy for my session.
We're delighted.
Hi, Emma. How are you?
We're delighted.
I'm spying to you.
Delighted to have you here.
No, a pleasure.
Yeah, what an honor.
Yeah.
And let's see, Jen. Hello, Jen. Would you mind just introducing yourself?
Hi, how are you? I'm Jen Nodal. I'm from Denver, Colorado. And I am, my business is patient self-advocacy. And so I am just interested in understanding more about what's happening with, I'm not sure exactly the specifics, but because I can't find the details about each room, but the public policy and social is really important to me to understand how I can help my patients
So
to
wonderful,
navigate
Jen.
the system.
Jen, thank you for signing on. And I think that's a lot of our mutual interests. So we'll have plenty of time for questions. And we're so glad that you signed on very early in the morning for you. So thank you. Hillary, would you mind introducing yourself and where you're from? Hillary? You're muted.
Oh, sorry.
That's okay.
Yes, I'm Hillary Loftus, and I work with the Hartford Foundation in Florida, South Florida, and I'm here to learn about public policy and more about how it becomes established in society in our country. We work with hyperbaric, medical grade hyperbaric oxygen therapy to help concussed student athletes, veterans, and other people with brain injuries to help them prevent chronic illness, chronic neurodegenerative disorders like Parkinson's and Alzheimer's in the future. So I'm very interested in hearing what you have to say and learning more about how public policy comes to be.
So interesting. Thank you so much.
Thank you.
Rita, would you mind introducing yourself? Rita, you might be muted. Okay. Hiroki, I know you're trying to be clandestine. Would you mind introducing yourself so people can know what a famous person we have here?
No. I'm not famous. My name is Hiroki Nakatani. Call me Hiro. That will be simple enough. I'm wearing 3 hats. That is too busy to on and off the cap. So I become a little bit some problem in here. And 3 caps is the first I am teaching at universities. But I think one of the work is the mentoring of young people to go to UN system. So that is number 1 job. Other job is I am a board member of several international non-profit organizations, including World Health Organization and others. So that is my 2nd cap. Third is advisor to the government. I am international health advisor to the Health Minister of Japan. So that is me. And I'm enjoying my holidays in Kyoto. This is particular week for Japan, for Japanese. That is respect silver citizens. So that is the week. And we have holidays. I am in Kyoto now. Over. Thank you.
Yeah, beautiful. Kyoto is one of my favorite cities in the
Yes,
world.
if you come, you are most welcome to stay with my den or study rooms.
Oh.
So I can send you my price tag for my colleagues. That is, if you bring Chateau Bordeaux, you will be accommodated with a room with shower. If you bring a box of chocolate, I can look after your luggage. You are most welcome. And Jen and others, that the same apply to you.
Thank you so much.
Not at all.
Rita, are you able to introduce yourself?
Yeah, I can't seem to get the video going, but
No worries.
I'm still interested in aging and whatever ideas I can get to take to the National Council on Aging as I work with the senior centers and their staff as to how we can especially meet the social determinants and overcome the problem of separation and loneliness.
Perfect. Thank you so much. So I'm going to get started. I have just a very brief talk, and then if more people have joined, we will have more introductions, and I want to have time to answer some of your questions. And you should all also know that Hiro has been involved with the Grand Challenge since the beginning as an advisor. So we have good support here. So I'm going to start. I'm sorry, I don't know what happened to my slides. They were here a second ago, but we had a couple technical issues. I think they got closed somehow. Okay, now we will get started. And this will also give you my background and introduction so that you can learn a little bit more about me. Okay, so I am really pleased and honored to be here. I have also been with the Grand Challenge in Healthy Longevity since the start. I have served on the President's Advisory Council for this initiative, as well as I chaired the second workshop for a report that we're developing. So I want to tell you a little bit about my background and my journey, and I'm mostly doing this to form a background for hopefully helping to answer some questions that you might have. So I have a very sort of varied background. That's why you saw the long and winding road. So I am a physician, internal medicine and geriatric medicine. I still actively practice, mainly right now in the homeless population. I do a lot of teaching, a lot of training, and a lot of research. I have an NIH portfolio of about $25 million right now. I have specialized training in aging and gerontology, also in epidemiology and public health. And in 2016, I completed a health and aging policy fellowship. And that is when I got involved with the National Academy of Medicine on this Grand Challenge in aging. I also completed an Encore Public Voices journalism fellowship so that I could learn how to write for the public. and that was in 2017 and 18. And then I have already told you I participated in many different healthy aging initiatives, including the National Academy of Medicine, AARP's Global Brain Aging Initiative, and many others. I'm an innovator and program developer, and I'm also a mother, a wife, a caregiver of a 92-year-old mother, and a new grandmother with my grandchild you see here, Juniper. So I wanted to highlight some of my experiences during COVID-19 and some experiences that really brought to the surface for me how important expertise in aging is and what a long way we have to go to improve healthcare and social care for older adults. So I work at a 600-bed long-term care facility in Boston at Hebrew Senior Life. We lost over 100 residents out of 600, 17% of our population in 2.5 months between March and June of 2020. That was the first wave of the pandemic in our area. There were literally refrigerator trucks lined up outside to take the bodies away. There were family members crying and screaming in the parking lot because they couldn't enter the building. And on a larger level, we all witnessed the widespread failure of our healthcare system to deliver adequate or appropriate care for older adults across settings, not just in long-term care, in the emergency room, acute care, in the ICUs, large-scale systemic failures, right? There wasn't enough protective equipment. There wasn't enough training for the staff. There were so many supply chain shortages. We couldn't get medications. We couldn't get essential basic things like gloves, that were needed for the care. We went into crisis standard modes in many locations, and there was actual age-based rationing of care. If you were over the age of 65 or 70, depending on your location, you were not allowed in an ICU. You were not allowed to have access to treatment in some areas. It required heroic action of individuals, which we all heard about on the news, but of course these are heroic, but they can only possibly have small scale impact amidst systemic failures. And so this motivated me urgently to use my background and skills to try to address issues and help to advocate for our aging population. So I did a huge number of projects related to aging and COVID-19. I also was speaking with the media almost every day to try to get good, true information out there and to counteract the ageism that I was seeing globally. And so I just quickly wanted to run through these projects, and I'm mainly going to just flash up like appetizer portions. So if you want to ask about any of these areas, and so you could know my background, I thought that would be helpful. So I did projects in how COVID-19 infection presents in older adults. I wrote in Nature Aging an editorial on how we can address, we should take this opportunity to address ageism in healthcare. I did a study to look at inadequate representation of older adults in clinical trials in COVID by reviewing their protocols on clinicaltrials.gov. Social isolation and loneliness in older adults was a huge issue, so I started a lot of work in this area. And I also participated as a moderator and an advisory board member for COVID-19 Conversations, which is an ongoing monthly series sponsored by the National Academy and the American Public Health Association. And now each episode is listened to by over 20,000 people and is considered one of the most reliable and accurate sources of information. They do a wonderful, wonderful job. So this is the first study that I mentioned where we found that COVID-19 often presents atypically in older adults. In fact, 1/3 of cases do not present with fever, cough, shortness of breath, the classic symptoms that are on the CDC and WHO checklist. They do not present with those. They present with delirium, they present with falls. And so many hospitals and healthcare providers were not aware of this, and older adults were not getting tested and were getting sent back to their facilities. And this is how I think the pandemic really spread. This is the second article in Nature Aging about creating an anti-ageist healthcare system, laying out a vision for how we might do that. This is the study on exclusion of older adults from vaccine and treatment trials for COVID-19. And this article, I am so grateful, it received widespread attention in the media. And in fact, it was able to change some of the vaccine and treatment trials to get them to enroll the target population. And it wasn't just age cutoffs that were the problem. There were a lot of other exclusions that weren't necessary that would unintentionally exclude older adults, like hearing impairment, the requirement for having internet in your home. Things like that, of course, are going to exclude some of the older population. I talked about the importance of delirium prevention and really getting at preventing social isolation and making sure older adults have the care they need, even during a lockdown, even during, being isolated in their rooms during COVID. And we developed a toolkit to help hospitals with this. And I can tell you hundreds or thousands of hospitals have downloaded our toolkit. And so we're really grateful. Just very simple things that people can do in the hospital rooms, even during COVID. And the New York Times published this article, again, about the same thing and publicized our toolkit. This is the COVID-19 conversation series. Again, you can learn more about it right on the National Academy website. It's still going on monthly. It's a wonderful, wonderful series. So my current research is in biomarkers for delirium. I also have a international network for advancing delirium research. So delirium is an acute confusional state in older adults. And I've developed a program that's worldwide in hospitals to provide better care for older adults in the hospital. Of course, all these programs got shut down during COVID, but now we're developing a remote version. A little bit about the Grand Challenge. I already told you that I played several roles there, and so I'm not going to spend time on that so we can get to your questions. But I did chair a workshop in Singapore that was sponsored by the National Academy of Medicine for this Grand Challenge. And this was sort of our vision that came out of that report of a healthcare system for the future that unifies healthcare systems, social and community care, and public health, and creates equity, addresses ageism, and addresses issues like financing, et cetera. I also am an associate editor at JAMA Network Open. I've only been in that role for a little over a year, but it has provided me another platform to advance aging research. We currently have a call for research in aging and addressing ageism. It's an open access journal. There is a fee to publish there, but the articles are open access and so have tremendous influence. The impact factor of the journal is 8.5 in its first year and rapidly rising. And so these are just some of the editorials that I've had the privilege of participating in. Structural racism, increasing representation of women. So there is so much opportunity in aging research. I absolutely think it's, probably the hugest impact we can have, as you've heard from this morning's speaker, Dr. Khan, as well as, from Dr. Zhao and others. The next round of Catalyst Awards will be in early 2022. The announcement is not there yet, but you should stay tuned. Please sign up. There's if you go to the National Academy website, you can sign up to get the announcements. You can be the first to hear when the date is going to be. And the vision is to catalyze innovative research, which will lead to changes in how we live and age. The past rounds have been $50,000 grants, but they are going to start getting larger. And the thing is, it's not just the grant itself, it's the opportunity to connect, to make collaborations, and the national academies will really also help you disseminate and get your ideas to scale, which is so much more valuable in a sense than just the award itself. So it's 50,000 times 10. Okay, so now I'm going to stop and open it up for questions, but I also want to see who else has joined us. So Cyprian, hello, welcome. Would you mind introducing yourself? Where are you from? Hi.
Oh, hello, everyone. I'm I'm not an innovator, but I'm an organizer. I should say a potential organizer for the Catalyst Award for the next year. And
Oh, fabulous! You're the person we want to talk to.
I just had the email exchange with Michelle before the last 2 days, but. It's nice to meet you all, and
very good.
I hope that there will be more innovators and more innovative proposals for the
wonderful.
Yep,
thank you. And I see Catherine has joined as well. Catherine, would you mind introducing yourself, where you're from, and your interest in aging? You're muted, Catherine. Okay. Emma, would you mind introducing yourself quickly to the group?
Sure. Hello, everyone. So along with Michelle, I am one of the organizers for the Innovator Summit. I am a NAM Senior Program Assistant working on the Healthy Longevity Roadmap. So I worked here with Jairo and the other commissioners on the roadmap end, and also helping Michelle out with the prize program end. So interacting with the Catalyst Awardees for this year and setting up this summit. So let me know if you have any questions about kind of the back end side of things with the summit, but otherwise, I hope we can have a great discussion. Thanks so much, Sharon. Your presentation was great.
Fabulous. And Michelle, do you have a moment? Michelle
I think she's on a call with Dr. Zhao,
okay.
So we'll let her.
That's
we'll
what
let
I
her
figured.
get off to the side.
She's busy running the entire thing. Okay, so we're open for your questions. Feel free, to ask about anything. We really want to help you in this area.
I'm curious about the research you did looks fantastic. I'm curious about whether or not, one of the things I've read about is the connection with older people and specifically their families, actually, that not just the connectedness in general, but that the connectedness with specifically their families has led to, greater longevity. Were you able to, did you find anything about that the, not just the connectedness to community and connectedness in the hospital helping delirium, but whether or not the disconnectedness from their families and loved ones impacted their outcomes?
Yeah, definitely. We have seen that really substantially. I think the isolation from family members has been one of the most detrimental effects on longevity during this pandemic. The longitudinal research is probably still underway, but definitely in the acute stage, there have been many detrimental health impacts of being separated from family. There's already been published studies to show worsening cognitive impairment in people with dementia, increased onset rates of delirium, which at least in part is due to disconnection from family. So I do strongly believe it's a huge factor. Yeah, so anything, Jen, that you can do in that area to improve that connection, either related to COVID or not, I think is really, really huge. And one of the things that I've been trying to do, like you see my work is in the hospital and the nursing home, is really to find ways to improve that connection with families. It's so critical. Because family, it's not just social support, right? Families are the advocates for good health care, right? Families are the monitors. They play so many roles. And so, Jenna, what are your thoughts? What do you think could be done?
You know, for some of them, I just feel, you have to do that cost benefit analysis, and that's what the difficulty is. It's just them going into these homes and, the facilities versus, and where's that line, where, and it's not it's not a disrespect for life or anything at all. It's more that, the quality of life,
yes,
that, and a lot of them don't even understand, they have this continuity of, that might be their only thing that they, I work in, or I have, my history is in memory care, assisted living. So I understand a lot of that consistency, when their children come, that may be the only thing they recognize consistently, their caregivers, and that, oh, their daughter comes or their son comes.
Absolutely.
And that may be their only quality of life.
Right.
So finding some way to allow for that connectedness in a safe way. I don't know, and I don't know what the answer is, but it seems like having them separated is not the answer. I don't know if it's that the families are able to suit up. I don't know if, I don't know, but it just feels like, especially with the length of this pandemic, I mean, when you're talking about a month,
right?
Okay,
right.
But when you talk about this has gone on now for, the restrictions have become much less.
Yeah.
When you're talking about 6 months and how long that went on, it's just
absolutely
really traumatic.
Thank you so much, Jen. Shuwen, do you have questions for me or for the group?
Hold on.
Okay.
Yeah, I just very curious about, you talk about the representation of the older people, either from the COVID-19 situation or other clinical situation. Can you share a little bit about this from your research or from your practical observations?
Inclusion in clinical research, Shuwen, specifically, or which studies specifically?
I think it's that the older people's representation in the clinical trial.
In the clinical trials, sure, yes. So what we did in that study is we reviewed all of the COVID-19 trials that were indexed at that time when we started the study, and it was, it was close to 2,000 protocols at that time. And so it was for vaccine studies, but also a lot of different treatments that were being trialed at that time. And what we did was I made a list of things for the team to look for. I trained them, and I had a group of 6 abstractors who went through. Each trial was reviewed by 2 different abstractors, and they went through and looked at what exclusion criteria were listed for the trial. And then we categorized those exclusion criteria by any that would preferentially impact older adults. Okay, so if they had an exclusion of hearing impairment, for instance, that is going to preferentially affect older adults, right? And if they had even if obviously if they had a cutoff of age 55, that will exclude all older adults. So that's obvious, and we collected that. But we wanted to drill deeper, you see, to see, okay, some of them required that you have a smartphone. Well, how many people over age 80 have a smartphone, right? Or even know how to use a smartphone. So that's going to exclude. And you know, I didn't just do it on my own. I had experts advising us. And I went to the AARP, who had just completed a technology assessment. And I said, how many people over the age of 65 use each of these technologies? And they actually, based on surveys of thousands of older adults in the US, they could tell me exactly, like, Wi-Fi in the home, you know, only 65% of older adults. Use of a smartphone, something like only 30% of older adults. You know, use of an iPad, you know, so I knew every kind of technology. And so we looked through, and some studies required that, right? Why they can't call someone on the phone to remind them of their appointment, why they have to be able to receive text messages. I don't know, right? Because it's 20-something-year-olds running the trials. So we went through for those and then found, you know, a lot of it, like stable hypertension was an exclusion from studies. Well, if you go over age 70, 65% have stable hypertension, treated, you know, not a problem. And if you go above 75, it's something like 80%. So, you know, I didn't even realize that until I reviewed the literature. And so I wrote that up, and, you know, so it was published in JAMA Internal Medicine. So it was huge. But this is long-standing, right? It's been published for cancer trials, cardiovascular trials. It's well known. And some of those exclusions are well justified, right? Some of them are well justified, but I don't think all of them were. And so that's what I wanted to do, a wake-up call, because the COVID treatments, as opposed to maybe other treatments, we had to include older adults. They are the target population, right? So that's what was different. You could not exclude them, right? And then when the vaccine trials started, a lot of them were only including, you know, younger, healthy adults. And through advocacy and through the article that received a lot of attention in the media, a lot of the drug companies started to contact me and say, can you help us figure this out? And so I referred them to groups that have that kind of expertise, right? So where there's a will, right, it can be done.
Right.
But thank you for asking that.
That's very important. Thank you.
Yeah, exactly. So any other questions?
I have a question.
Yes, please, Hillary.
Yes, so very interesting presentation. Thank you. And I was wondering, do you have any ideas about the biomechanics, if you will, for why do a third of the adults over 65 present with delirium? Is that because of underlying neurological conditions and how the inflammation affects their brain, or what is the reason for that?
Yeah, so that's the reason I have $25 million of funding from the
Oh, yeah.
to figure that out. But the short answer is that older adults have less cognitive reserve, right? So if you take the average, let's say 70 or 75-year-old, under conditions of good health and no stress, can function fine, right, in the world. But let's say you give them COVID-19 and a high fever, and they become dehydrated and they start going into kidney failure, which is actually a very common scenario in older adults early on with COVID. then all of those stressors to the system may cause the brain to start not functioning well, even in someone who had no underlying dementia. But if you superimpose on that any kind of maybe mild cognitive impairment or even dementia, you're even at higher risk to get a delirium. And so I think it's sort of that multifactorial contribution, Hillary, that's contributing to the development of delirium. And it's not just delirium. Older adults are much more likely to fall. They're much more likely to develop failure to thrive or frailty as well with COVID.
Do you think, thank you, do you think part of it is because our brains use up so much oxygen compared to the rest of our body, and COVID-19 is, an oxygen depriver, right? And it takes oxygen away from all of our cells. It's, a very simple way of stating it. Do you think the lack of oxygen plays a part in these issues, the older adults with COVID?
It certainly might be a part of it, and particularly during COVID, I think you're right. And if I remember from reviewing those thousands of trials, if you go to clinicaltrials.gov, I am pretty sure I remember seeing an oxygen intervention. Perhaps.
Yeah, I was wondering if you'd worked at all with the hyperbaric oxygen therapy intervention for COVID-19 trials that are going on, and I think it's at least a dozen hospitals in the country.
Right.
Yeah.
I haven't been involved, but I think it would be a dynamite area to examine.
Awesome, good. I would love to stay in touch with you about that.
Okay. That's wonderful.
Thank you.
Sure. I hope you'll consider putting in a Grand Challenge grant on the topic.
Oh, okay, great. We did put one in this year.
Oh, fabulous.
Yeah, about how it would help with the prevention of a neurodegenerative disorder such as Parkinson's. Yeah. Mm-hmm.
That's great.
Yeah. We'll have to talk to the team and next year. Thank you. Mm-hmm.
Wonderful. Great. Any other questions? These are just really insightful areas. If there aren't immediate questions, I don't know if maybe I could ask Cyprian to talk about the next call, and is it going to stay sort of similar? I don't know, Cyprian, are you allowed to inform us about, is it going to be similar to the past Grand Challenges?
Well, I don't think it's appropriate for me to say anything here. I'm from Hong Kong, and I haven't concluded the collaboration with the NAM yet.
Got it.
So there's so much to do in the coming months with Michelle.
Yes.
So hopefully I will have some good news for the Hong Kong, the researchers in Hong Kong.
In Hong Kong. Very good. Right. I understand, right? Hong Kong gives out the awards in Hong Kong. So that makes sense. So thank you.
Well, actually, 2 universities in Hong Kong have joined this Catalyst Award this year, but I am from the government and the University Grants Committee in Hong Kong. We haven't, we have learned something from the 2 universities, their collaboration with the NAM this year, and we'll follow through that process. And so hopefully we can open up the competition next year for the 8 universities in Hong Kong.
Fantastic. Yeah, and just for our listeners, the Grand Challenge is really a global initiative. There are many, many countries participating, which is so exciting. And I hope you all will be able to stay on and listen to the awards that are announced, because if you're considering it, it will really help you think about, what is likely to be successful, because you can hear about the types of projects that were awarded. Hito, do you want to share your perspective on the initiative?
Oh, well, I think aging become global issue, and each country has unique stage of aging, and also a unique social and resource setting. So I think global challenge is really good term. I think every countries are encouraged. Every country's team can be encouraged to join. So I'm looking forward to next year's grand challenge. Thank you.
Wonderful. Thank you. And I know it's been so successful so far. I'm wondering how the council feels about the progress so far, despite COVID, right? Which has changed the landscape. Is the council pleased with the progress that's been made?
Sure. And with regards to a healthy longevity report is concerned, now a process of completion is accelerated. So we are hopeful to publish in early part of next year. So that is what we are working for.
Fabulous. Wonderful. And then we have a new person who's joined, Dr. Murthy. Hello. Could you introduce yourself? You might be on mute. Okay. So are there any further questions?
Sharon, I will chime in quickly. This has been an amazing discussion and exactly what we had hoped for these breakout sessions for everyone to discuss and meet each other and talk about what could be going on in the future. So thank you so much for that.
Whoop.
Sorry, I hit it midway. I do want to remind everyone that we do have more breakout sessions occurring, just actually starting around 9:15. Hero will be joining us, so make sure you log off of this in here and pop over to your next session. And I'm going to head off to, I have to get on the back end with Michelle, but thank you everyone. Feel free to exchange contact information or anything else. And thank you again so much for joining. And Sharon, this was really amazing. It's such a pleasure to have you. So thank you.
Thank you. Thank you.